Welcome, everybody, to another edition of Speak Easy Dental Podcast with your host, Dr. Neil McCarr. I'm very fortunate. This is actually, I think, my fifth episode, and every episode just keeps getting better and better and better. I've got one of the leaders of dentistry for a while, and I need to really introduce this guy because I've been following him for a while, and I love what he's done in dentistry and his views on dentistry also. And plus, it's all Canadian, which I love. All right. So, he did his undergrad degree at Wilfrid Laurier in finance. He obtained his law degree at the prestigious University of Toronto Law School. I became a corporate lawyer at the prestigious law firm of Blake, Castles and Graydon. Well done. Then in 2014 to 2024, he became the president and secretary of the biggest dental organization in Canada, referred to as Dental Corp. Today, he is a well-respected and is on several advisory boards such as ClearDent, and just recently, one of my fun things, AI, and his association with a company called ARAQ. On November 19th, 2021, he was named as Canada's top 40 leaders under 40 for 2021. He is an outstanding true leader with outstanding management skills. If you follow his story, you'll know why. You know, uh, Guy, I'd like to welcome you to the podcast. And before I get into anything, I gotta know this because there's two things that I truly love. I love BMW cars, okay, and I love sports, okay. How the heck did you become a BMW analyst way back before you even did anything at all?
Yeah, let me get into that. But first, uh, couple of things off the top. One, thank you for having me on here, and thank you for the that very nice, not deserved, but very nice nevertheless. So while I was at Laurier, I'll get into the BMW story. The program at Wilfrid Laurier, which I think is one of the best business programs in the country, particularly for those who may not have a specific idea of what they want to do, had a co-op stream where for 3 4 month stints during your 4.5 year undergrad, you'd go through this organized co-op program and spend 4 months at a variety of different organizations. And I think it's fair to say that Laurier's co-op program is the best run. It's not the only one in the country, but it's certainly well organized. And they've got a lot of blue chip organizations who have a pretty entrenched relationship with the school. And so I had an interest in finance. It's where my area of focus was at Laurier. And so my first couple of co-op programs were in, on Bay Street at investment management firms. But much like you, I love sports and I love cars. And so ironically, in my last co-op term, I said, the finance jobs are always the best paying and, in a lot of ways, the most in demand. BMW, the analyst position there, one, it was all the way out in Whitby at the time. And two, it was the lowest paying job of all of the other co-op ones. And I think part of it was because one, I don't mean to denigrate them, but they are very cost conscious as an organization. And if you drive a BMW, I think you can probably see some of that coming through these days. But two, because of the brand and the passion that it incites in people, I think they rightfully felt that people would take less money to work for them. And I was the poster child for that. And so I applied for the position, went for an interview. I think the extent to which I can geek out with people who work at BMW about cars and BMWs in particular probably helped me land the gig. And so I spent 4 months there as my initial co-op term, and I had a bit of a break between undergrad and law school, and so I asked them if I could stay on a little longer, and they thankfully agreed. So
I got two boys. Do you think either one would become dentists? Absolutely not. Uh, well, one's a he's a portfolio manager. He's doing really well for himself. And the other one's a
good for him.
software engineer. But I guess this question is leading to you. When did you first know that you actually wanted to be a lawyer? I know you wanted to financing, and then all of a sudden you hit law school.
Yeah, it's I don't know if I have a great explanation for it. It's one of those things I think I knew I wanted to be involved in the business world. I knew I loved call it all matters of commerce. And I just found the idea of the business world and everything from entrepreneurialism to well-established blue chip organizations, the things they do and the impact they have in the world, I always found interesting. But being an immigrant and being the son of immigrant parents, you sort of get defaulted into having to choose a profession with a title, and businessman doesn't quite cut it. And so it's accountant, it's dentist, it's doctor, or it's lawyer. And so I sort of just said, I didn't feel like I had, the inclination towards something more clinical in nature, even though I really have a passion for healthcare. I just didn't think it suited my own strengths or frankly my own weaknesses all that well. And so I said, look, I'll be a lawyer. Who doesn't love a good fight? And so I decided to be a lawyer. But again, I knew I wanted to do it with some sort of connection or nexus to the business industry. And so I knew pretty early on that if I was going to be a lawyer, I wanted to be a corporate lawyer. Not really understanding what that meant. Frankly, I don't think most people know what that means. I was in law school and I still didn't know what that meant. I just had decided to be a corporate lawyer, and so I did that for literally much longer than I thought I could possibly do it because it's a particular profession for a particular individual, and it's not for everyone, I'd say.
Yeah, I'm going to take you really far back here for a second. Okay. You're probably going to get amused by this question, but finance, law. When was the first time that you ever heard the word dentistry?
When I got a call from a recruiter at the law firm. So again, I've always quite genuinely had an appreciation for and a degree of interest in healthcare. My wife, I met while I was in law school. She was in med school. I actually did apply to med school while I was in law school, and I think thankfully for every patient that I would have seen, I didn't get in. Um, so so it's always been healthcare in general has always been an area, but I can't say dentistry was one thing that I had any inclination towards or even understanding of. And I remember I got a call from a recruiter while I was at Blake's pitching the job, and this is a recruiter I knew. I've spoken to her before, and she had said, Guy, I think I've got something right up your alley. And I said, okay, very, very interested. Let me know what the details are. And she said, it's in dentistry. And I was about to say, okay, this conversation's over. We can hang up the phone now. But in all seriousness, she said, hold on, let me explain to you. And she gave me at that point, Dental Corp was only about just over 2 years old. She had given me a high level overview of the business model, what it was trying to accomplish, what its ambitions were, and to me, the minute I heard it, and not everyone feels this way, but I think a growing number of people do. The minute I heard what the overall premise of what they're trying to accomplish, it just made intuitive sense to me. And the devil's always in the detail, but it just made sense to me. And I said, oh, I'd love to meet the founder, and I did. And about 2 weeks after that first phone call, I was all of a sudden in the dental industry.
Wow. You know, my father really, when he came to Canada, he always told us, I have three in my family. One's a medical doctor, and another respiratory therapist. You all say, listen, in this country, you got to be your own boss. You're either going to be a
Yeah,
dentist, a doctor, a lawyer, or an accountant.
yeah,
I knew I didn't
yeah,
want to be a doctor because my budgie bird died. I cried for 6 weeks, right? So, right. And I knew I didn't want to be a lawyer because I can't argue that much with people,
yeah,
and I hate numbers. So actually, when I
yeah,
went to dental school, I'll be honest with you, guy, I hated it. I hated dental school. I
yeah,
just went because this is what your dad said. You can relate to this. You said the son of an immigrant and stuff, right?
yeah.
But after I graduated dental school and experiencing patients and healthcare and stuff, I actually enjoy it. I love it, right? So it's been 35 years now, and I got no complaints about it at all. The only thing is with dentistry.
I'm sure I'm sure you do, but I think
Yeah. Well,
everyone
just I
has
was
something
I
they
was just
complain
getting to
about.
that. Okay. I was just getting to that, So, with dentistry, like, we have that dental community, we got our own little perks, right? And
Yes, yes.
different personalities and stuff like that. So that today that's even a little hard for me to get into, but I enjoy dentistry itself. So I imagine your last story, the person that hired you was for Dentalcorp. Is that correct?
Correct. Yeah. Yeah. That
Okay.
was Graham
Yes.
Rosenberg, who's still the CEO there.
Yeah. So, um, what was when you got into that office in the first week or so, okay, and you didn't know much about dentistry and stuff, and I'm sure a lot of things came at you all of a sudden, right? Because dentistry is, oh, it's a moving wheel all the time, right? What was your first thoughts? You say, hey, am I doing the right thing, or am I gonna hang on here, or
Uh,
what?
It's interesting. So, when I was at Blake's, they were on the 40th floor of one of those shiny Bay Street office towers, marble countertops for the reception desk, and exactly what you expect from, one of those prestigious big corporate law firms. And when I went for the interview at Dental Corp, they were in a mid-rise tower at Yonge and St. Clair. It was only about 30 people at the time, small corner, small portion of a small building, and it was under construction. My interview was literally on tarps as it was undergoing construction. And so in a lot of ways, it was a company still being built. And, even when you get in there, you realize it's still a company very much still being built. And, part of you, I think, and anyone in that situation coming from a very established institution, Blake's is over 200 years old, you sort of wonder, what did I get myself into? I will be honest, I didn't really think about that all that much. I think there's so much excitement around what the opportunity was, what the vision was, that it's easy to literally look past the tarps on the ground, the holes in the wall, and feel excited about what the opportunity that was before you, which is to build this amazing, in a lot of ways, one of a kind organization in this super important, quite large and extensive industry. But you were right. Initially starting, it was like drinking from a fire hose, as the adage go. But you talk a lot about, or in your question, you mentioned this idea of dentistry being a whole new world. Um, One of the things that were made quite clear early on in Dentalcorp, and I think this is a good thing, was that there's a real divide between the clinical element of dentistry and everything that surrounds and supports that clinical element. And so, you didn't really have to know or pretend to have to know what happens between the dentist or the hygienist and dental professional in the chair, because to a certain degree, you were never going to get involved in that in any event. What you needed to do is really understand all the different ways you can make that process better or easier or more efficient, or for better outcomes for either the patient or the professional. And so it was good because I don't have a clinical mind, so thank God I didn't really need to learn too much about the clinical part of it. So you can really focus on what are the things that we can do as an organization to again make all the things about from the minute the patient walks in the door to the minute they leave, make it a better experience to supporting dental professionals in facilitating that.
Yeah, I
And
love that.
that's a lifelong journey. I don't think it ever
Yeah.
ends.
I love that answer. Absolutely. I
Yeah.
think that's great. I'm going to avoid asking my second question because you just answered it basically. Right? I was going to ask you, like, how could you do that job without being a dentist? But that was eloquently well said. A lot of people don't get to experience what you got to experience. Okay. You walked into an organization as Dental Corp. You started from the beginning. Okay. For the next 10 years, you saw the growth. Okay. And how exciting is that to see the growth as you go year from year? Okay. And then all of a sudden, in 2019, you were asked to be president of this huge organization, the biggest DSO in Canada. All right. So, a lot of listeners, I think, want to know, how does that feel like going from point A and then going to the highest part of this organization? Okay. And all that journey going through there, like all the stuff you learned within that organization.
Yeah. A complicated set of feelings, I'd say. A couple things that I think everyone in some shape or form should strive to experience in their life, and that is being part of building something, whether it's a single clinic, whether it's an organization, a charity, whatever it is, be part of building something. Because when you do, join an effort in building something, again, there's a lot of different ways you could be part of that, regardless of where you are. You find this degree of flexibility and opportunity to do a whole variety of things that you don't have any experience in doing. And I'm of the individual, I'm of the type that I know my limits. I have a high degree of humility around those, but I also feel comfortable taking risks and comfortable trying things that I may not have experience in, and making sure that I learn about them. And so, joining this young organization, which still to this day is very flat. People look at the size, it's almost $1.7 billion in revenue, almost 600 locations. It's the largest and seems so large, but I think from day one to the day I left, Dental Corp has done such a great job at making it feel relatively flat that you didn't feel like I was going all these levels up. I've always felt like it was a small family of a bunch of individuals trying to do something, and you always felt like an important member of that family. And so when that transition to president was made, it didn't seem like this massive leap because you always felt, and I think a lot of people there feel, regardless of what their title is, that they're a meaningful part of that overall leadership team, driving the company forward. And so it felt much more gradual than it felt this sort of one leap at a time. But to be honest, I think roles and titles there thankfully don't mean as much as people think they do in most organizations because again, it's done a great job of still being very entrepreneurial in spirit, and people can really stretch beyond the confines of their title or their scope of their responsibility. And as I think any organization strive for the same thing. And so you're right. Unfortunately, not a lot of people get an opportunity to experience that. But I think if you are part of building something from the early stages, you get to realize that sort of as the organization grows and as you evolve in it, leaps and changes in titles don't feel like monumental changes because you're sort of doing everything all the time anyways.
How do you feel it make you grow as a leader?
You learn a lot of the ways things go horribly wrong. So, yeah, look, I think it's important. For me, I've always felt that the difference between people who find themselves in positions of leadership and those that don't is the willingness to make a decision. It's not that they always know what the right decision is. It's simply the willingness to make that decision. And then importantly, taking accountability when the decision doesn't go the right way. And so it's not, again, I don't think leaders are smarter. I don't think it's that, they're better at leading people than someone who's not. I think they're simply willing to make calls. And when you're building an organization, I think if you don't understand that you're going to make a lot of wrong calls, you probably shouldn't be part of the leadership team. The important thing is making those calls, learning from them, both when they go right and when they go wrong, and making sure that when they go wrong, you truly understand and feed that understanding back into a decision-making process as a team. And I think at Dental Corp, there's a lot of things that we tried, and it was an organization that was willing to do a lot of different things. But an organization by the same token that was willing to live with those things not working out as long as we learned from them and as long as we deployed the right decision-making process to get at them. And so for me as a leader, it was an exercise in stepping out over my skis every day, almost every meeting, and constantly thinking about ways that either worked or didn't work, or being open to trying things differently. And I think that degree of flexibility and lack of rigidity, both in my approach to leadership and the organization itself, worked out quite well.
There's one thing you and Donald Trump have in common. Okay. That is you
What's that?
both that is you both navigated as a leader through COVID. Okay.
Yeah, I guess, yeah.
Right.
Yeah, that's fair to say.
I remember that time myself. Okay. And I got to tell you, it was depressing. Okay. Within the dental community, of course. Right. Because dentists were like every other health profession, were forced to do things they didn't want to do. Right.
Yeah.
Um, and I know at that time you led that whole area at Dental Corp with all your leaders and everything through COVID. What was your thoughts during that time? Like, there's so many changes going on within like a 12-month period, right? And I'm sure you got a lot of pushback from dentists and saying like, the PPE, wearing these gowns, we're not working and all this stuff. Like, how did you handle that personally and obviously as a leader in a company?
Good question. Yeah, to be honest, I haven't thought back on that time in a long time because it was such a blur, and so I think we all suffer from PTSD from that extended period of time, particularly for those in Ontario where it sort of seemed to never end. Look, I'll say it certainly wasn't me alone. There was a literal army of people. I remember when everyone knew in dentistry the lockdown was coming. I believe it was a Saturday. The entire executive team was in the office, and it was like midnight. And at some point, a bottle of wine got cracked open. And all to say is that there was this degree of, look, it's here. You know, it's not like we were blindsided by it as an organization. We were preparing for it back in December, quite honestly. So it's here, and let's look at this as an opportunity. Certainly going to be a daunting challenge, but for us, the question was, what do we do to look at this as an opportunity? And the one answer that came back was, sort of twofold. One, we want to do things to demonstrate the power of what this organization can mean for dentistry. And in that way, it was we've got resources, we have a literal team of people who are in compliance and regulatory affairs, including who had healthcare backgrounds from a policy perspective. And how do we leverage those resources to help not just dental corp dental professionals, but any dental professional to navigate the daily change and what those regulations were, or simply understanding the complexity of those regulations. And so the answer to us was, let's be leaders in a time where, and not to speak ill of any dental association at provincial or federal level or college, I think they were resource constrained, and they were going through this at the same time. And so it did create a bit of a vacuum where Dental Corp could step up and say, look, we're going to help fill that void to help navigate dental professionals and therefore ultimately help patients through these fairly choppy waters. And second was, I don't know if this makes me a masochist. Having chaos and insanity around sort of gets the adrenaline pumping, and you want to face those challenges head on. And for us, it's how do we use this as an organization to get better, to get stronger at the things that we want to get stronger on. And so we did look at it very much as an opportunity. And I think when you frame what is and what felt a lot like a war, of survival, when you frame it in that positive light, I think it goes a long way to shedding light on opportunities that get you more excited than feeling like, oh, the world's ending, and feeling more of like a victim during that process.
Yeah, that's really good. That leads me to my next question, right? Dentistry today, right after COVID. One of the situations in dentistry today is shortage of dental assistants and dental hygienists, and the wages are just going through the roof, right? It's almost like, what did I say somebody the other day? I go, it's like a Sotheby's auction. I'm going into the auction to get a hygienist. Oh, $50 an hour here, $60. I'll take 70. Yeah, da 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 da, right? It's not like for me, I really don't mind paying the wage, okay, but it's got to be returned back, okay, in the form of productivity and etc. But now I find it's just gone all over the place. So, how do you feel as moving on? How are we going to handle this shortage of dental hygienists and dental assistants? Do we need to bring more over from different countries and let them get in, or let them get certified? And let's get this done, right?
Yeah, it's I would say, you know I can't believe it's still a problem. It's quite shocking. I'll say this. I remember I made a LinkedIn post back when I was at Dental Corp. I believe it was in 2023, and I highlighted, and it may have been published. I think it was an op-ed in a newspaper. I highlighted the shortage of dental hygienists and dental assistants, and I pretty quickly got reached out to by the Canadian Dental Hygiene Association in earnest and genuine, and we had a great relationship. But the comment back was, we don't see a shortage. And I found that disconnect, or the dissonance between what for as an organization, Dental Corp, we felt there was a significant shortage. I think most independent dental professionals would have felt there was a shortage. So there was this sort of disconnect between in this case, the Association of Dental Hygienists and frankly, I'd say the dentist contingent. Um, to answer your question about what do we do, look, I think all those things that you had mentioned go a long way. One, and this applies to any other healthcare profession as well. There are a significant number of very well trained dental professionals, support professionals around the world. And obviously, I think that on the dentist side, some people would point to a difference in treatment philosophy or treatment capability of foreign trained dentists. And I think that people mistakenly apply that experience to what it'd be like to have much more uh, called flexibility in the country's willingness to take on individuals licensed as dental hygienists or dental assistants, as an example. And I think it's much more difficult, ironically, to become a dental hygienist being foreign trained than being a dentist, which doesn't make a lot of sense to me. And it just again speaks to some disconnect in the industry, that doesn't make a ton of sense. I also think there's an opportunity for dentist owners or dentist employers, whether they're part of a group or they own their own clinic, to lean into the things that help accomplish a couple of things. One, um, I'll explain this by citing something that Dental Corp's head of HR always used to say, and I found it profound. Um, people leave for money when they don't like where they work. I'm paraphrasing what her phrase is, but
Mhm.
effectively what she's saying is they will leave for money if they're not otherwise truly happy. And I think to a certain degree, money will always be a strong contributor to how people feel happy in their work, but it's not the only contributor. And in some cases, it may not be the most important one. And I think, I've seen some independent dental offices have wages well lower than the average. And the one recipe across all those examples that you see is they really lean into creating an environment where staff feel respected, feel trusted, feel that there's a high degree of priority on well-being of patients, where they feel like it's a family. You wouldn't leave your family to go join another one for some economic opportunity. And again, it sounds muddly, it sounds a little hokey, but there truly is this meaningful correlation between the environment you create for your staff and their desire to be like, oh yeah, I'll go down the street somewhere who I don't know for a boss I've never worked for with a team of people who aren't like my family for an extra dollar an hour. It's really not, even if that. And I think those practices that truly understand the little things you can do, and look, they're not easy things to do. They require a lot of patience. They require, in some cases, a dental professional being an HR leader, which most dental professionals aren't trained to do. But if you do that, I can almost guarantee you it's going to be an easier challenge to navigate. This idea of having difficult conversations with staff around wages, and doing the certain things that make that difference. And is it a silver bullet? No. But I think, unfortunately, in a world where 94% of dental practices are still independently owned and operated, people will say, look, I'm willing to pay more because it means that I can continue to make more individually, and I don't have the sort of same constraints that groups do. Ironically, in industries where there's much more consolidation, there's much more, let's call it, coalescence around sort of wage bands. But in a fragmented industry like dentistry, people are going to do some crazy, wacky things, and it has an impact on everyone else.
Family, that's a good point. 2002, 2005, went to LVI to learn cosmetics. I took my team with me every time.
Yeah.
And for those 10 years, I never lost one staff member. It's exactly what you just said, right? It's creating that environment and stuff. So I think we really need to get back to that. I have one last DSO question for you, then I want to move on to what you're doing today. Okay. Do you
Yeah.
feel that, okay, the two big DSOs in Canada right now are your Dental Corp and 123 Dentists. Do you feel that these dental support organizations, the big ones, will eventually go into the United States and start acquiring dental offices? Or do you feel um, American DSOs, such as one of the biggest one of them being Heartland Dental, okay, will eventually come here and inquire perhaps one of these two big organizations? Which way do you feel things are going right now?
Uh, well, I'll say this. I think both could happen, but I'll expand on that a little bit, and I'll start with the second half of your question. Well, I mean, Heartland is the largest in the world. Um, Heartland's effectively already in Canada. I don't know how many people appreciate this. So Heartland Dental is both a direct investor in 123, and Heartland Dental is also entirely owned by the same private equity group that owns a majority stake in 123. And so, and I think 123 doesn't shy away from this, nor should they. They talk a little bit about some of the collaboration and opportunities for sharing of resources that's taken place between 123 and Heartland. And so, whether that means Heartland is technically in Canada, I don't know if it sort of matters. As an organization, they clearly have a relationship with 123, and there is some cross-border sharing of business practices and resources. And so, I think that's just the first step of US DSOs at some point looking at Canada. And I think uh, you know, I've spoken to some of the other large ones, and in a lot of ways, the Canadian dental market is much more attractive than the U.S. In the U.S. dental market, you've got a significant higher portion of patients on some sort of government program, which means you don't have real pricing power. And even if they're quote unquote private, you don't have pricing freedom in US. It's not up to the associations to come up with fee guides. It's up to the insurance providers in the US, and they are a tough bunch to work for because every dollar of fee guide they give out is a dollar they don't make in terms of profit. So they've got different consideration sets than the provincial associations. And I was speaking to last year, I was speaking to a CEO of a 700 plus DSO in the US, and he said from 2021 to 2023. So think of the years where inflation was the worst possible thing for a dental clinic. Over those 3 years, they were given like a total in the aggregate 1.5% increase in fees.
Mm.
You imagine that as a dental professional over the three most expensive years in terms of labor rates and PPE and consumables, your provincial fee guide, your province association told you your fee guide's only going up by a total of 1.5% over 3 years. You would, yeah, whether you would go under or not, I'm not sure, but you'd certainly be crying foul, and you'd be right in doing so. But in Canada, you've got a much more attractive overall industry, and there's certainly less consolidation. So I do think there would be interest from U.S. consolidators. And again, Heartlands are effectively already here with 123. I don't think that's a bad thing. I don't think that should alarm anyone, other than making sure people say, how do we distinguish ourselves as a DSO? And the best way to do that is continue to be able to deliver on what the inherent value proposition of a DSO is how do we support dental professionals to allow them to be better clinicians and treat their patients with a better experience? And how do we arm them with resources? And how do we leverage our scale to make things a little bit more efficient or cost effective? If you could just focus on that, it doesn't matter who you're competing with, whether it's 123 or Heartland or Aspen or it doesn't matter whether it's Canadian or American. I think the days, this is a long-winded answer, but I think it's important. The days where um, there was a material difference in terms of philosophy of Canadian versus US DSOs, I think are over. I think a lot of US DSOs have learned rightfully that, you can't do things like quotas. You can't really force clinicians to do things at the expense of their professional standards or at the expense of patient care. And I think a lot of those myths took a life of their own versus being grounded in things that actually happen in the US. Now, US culturally is different than Canada, and I think how they think about dealing with dentists will be possibly a little bit more transactional, a little bit more business oriented. But I don't think there's going to be a material difference between the two.
Great. Thanks for answering that question. Let's move on to you, Guy.
Yeah,
All right. And what you're doing today. All right. The evolution of dentistry is really changing so fast. It's like every year you're seeing new technology come aboard. And I'm excited about AI. I really am excited about AI. And I also noticed that you're an advisor for an up-and-coming company called Ora AI with Dr. Mishkana,
yeah,
right?
OrQ. Yeah,
Or Q.
yeah,
Like what are your views on AI and what does I know I've seen a lot like DiagnoCat and stuff for like just reading x-rays and stuff, but what makes this AI company different from all the other ones out on the market, and why did you decide to be an advisor for this particular company where there's so
yeah.
many other AI companies on the market?
They're the only one who asked. No, I'm kidding. I would say a couple of things in that question. Where do I see AI generally as it pertains to dentistry? It's a game changer, and I think that the hype into a lot of to a large degree is deserved. We've all hopefully seen the power of just even diagnostic AI, the power that can give to a variety of dental professionals in terms of helping them, making sure that the diagnosis process of their job is done to a consistent standard. And I think that's really what this AI is about. It sort of helps elevate everybody to a consistent standard, a proven clinical standard of particularly diagnosis from images. I think in a lot of ways, AI goes really far in empowering patients. Healthcare consumerism is a broad term, but one of the things that it talks about, and one of the things that it insinuates, is this idea that patients need to be more empowered and need to understand a lot more about why they have a certain need for healthcare treatment and what the basis for that need is. And I think dentistry has been unfairly painted as a fairly opaque healthcare. Most patients don't understand what it is a dentist sees. And I don't think, I'll say this, not being a dentist, so hopefully no one will throw tomatoes at me. I don't think as many dentists as there should be do a good enough job explaining things to patients. I think, the feedback we got from a lot of patient studies and experience that I think a lot of people talk about as patients is I trust my dentist or my dental professional, but I have no idea what it is that, what they're referring to, what I need, or why I need it. And I think that lack of transparency makes patients feel less empowered than they ought to, because I do think the vast majority of dentists aren't intentionally forcing treatment that's not necessary, aren't misdiagnosing or being negligent in their diagnosis. It happens, but I think again, dentistry gets painted with an unfair brush in a lot of ways, and AI really equalizes that. I think it gives patients this undeniable, it's right there on the screen through a lot of these different platforms. You can clearly see the variety of different treatment needs that you have. Let's go talk about what those treatment options are for you. And so it's really powerful for both the dental professional and I think the patient. And there's very few advances in technology that are as easy to adopt as AI that makes such a massive positive impact for both people in the healthcare equation like it does here. And so just generally speaking, I think it's a game changer. And it's great to see so many different platforms in that space. Now, what makes OraQ different? I think the Overjets, Pearls, the Vidias, the DiagnoCats, the Denti AIs, they really focus on that fundamental pillar of how do I interpret, come up with a diagnosis or interpretation of a dental image to help facilitate better diagnosis and help facilitate better, healthcare at the very end, which is great. It's important. But I think if you, as a dentist, and again, I'm not a dentist, you would know this better than I would. There's a lot you take into consideration in terms of what patients need in terms of dental treatment that you would suggest. And it goes well beyond something you see in a picture. Is that fair to say?
Yeah, absolutely.
It's their history as a patient. It's their overall medical history. It's their overall circumstances. And, all those are data points that any good clinician should have to take into consideration when it comes to what's the ideal treatment for them. And ORQ, you know, has that element of, okay, what is this, point in the time image tell me about what this patient needs? But I want to also look at the medical history and every single data point about this patient's current health circumstances that I can take into consideration to come up with a more comprehensive treatment plan that allows the patient to understand there's a whole host of things that we're taking into consideration to come up with what the ideal oral care plan for you is over the next few years. By the same token, to the same, to a health professional in the same way. And so I think it's just a broader approach of the same premise of leveraging millions and millions and millions of data points and standards of care with well-regarded clinicians to say what does this patient really need and how can I help the dental professional identify what those needs are. And OraQ to me is just the one that goes significantly further than some of those other established players and taking a much more comprehensive approach and leveraging AI to do it.
Yeah, I love that, and I love how you explain a different part of that AI company. And just one point you kind of talked about, which is kind of cool, is communication between patient and dentist, right?
Yeah.
Last week, I got to interview Dr. Howard Ferran of Dentaltown, and he brought the same thing up. He goes, dental schools got to quit taking kids that have a GPA of 4.0, he goes, because they just don't know how to communicate, right?
Nope.
And I was thinking that's really funny, and I'll just end it with a funny story here for you on that part. I had an associate, patient needed a root canal, and I wind up seeing that patient, right? And she said, "Look, I saw your other dentist, and I had to go home and go on chat, AI, chat GPT, right? And ask what a root canal is."
That should
Like,
never happen.
so I go, "Well, what did he say to you, right?" He goes, "Well, just told me that, there's going to be an access opening. We're going to instrument the tooth and obturate it." She goes, "I don't know any of that language at all."
I barely know that language.
So yeah, you're right. So people, a lot of us dentists forget that, there's technical terms and there's layman terms, right? And the
Yeah.
patient is never going to understand your technical terms.
I bet you if you were to ask, pull 10 people in your local community that aren't your patients and ask them who their favorite dentist is, and you'll probably get 10 different answers.
Oh,
And
absolutely.
if you were to put those 10 different dentists in a quality of dentistry competition, I
Yeah.
bet you there'd be no correlation between who's the best and who's the worst. But the reason they get rated the best by their patients is because
Yeah.
they go above and beyond in terms of chairside stuff.
Yep.
And like for better or for worse, patients will trust you if you go out of your way to communicate with them, make it a trusted relationship, talk to them so they don't have to go home and use Chat GPT to figure out what's going
Yeah.
on. Like you
Yeah.
could you could do a terrible root canal, and that tooth could be in decay. Well, what you could do a whole bunch of and patients won't really know, and that's the irony of it. Patients don't really know if a dentist is doing a great job, but they
Mhm.
know if they feel their dentist is doing a great job. And so there's so much importance in the chair side stuff.
Yeah.
Obviously the clinical execution is the most important thing, but from a patient's perspective, they can't assess that. What they can assess is, is my pain gone, and do I like the experience I just had with this dental professional? And I don't think the young ones appreciate that as much as they should.
You nailed that 100%.
Yeah.
So, getting to the end of the podcast here, what is the future for Guy? I mean, what's the future for Guy? Not just in dentistry, but what are your plans down the road?
Yeah, I'm still supporting ClearDent and NorQ, both organizations in my mind that are leading their respective industries in a way that's exciting for me. While I was at Dental Corp, I won't call it whatever the opposite of the word privilege is, the curse of dealing with 26 different PMSs. So getting a pretty good flavor for the importance of what a dental practice management system, how important it is, but also how frustrating so many of them can be. And I will plug ClearDent because I joined them because again I believe in the platform they built. They to me have a dental PMS system that's head and shoulders above their competition, and that's an exciting organization to be supporting that regard. And similarly, OraQ. I believe they've got the right comprehensive approach to leveraging AI in dentistry. And so we'll continue to support them. I am working on, in it's the early stages, but I am working on what I view as an opportunity similar in terms of consolidation opportunity, but an opportunity outside of healthcare that sort of again marries this idea of advancing the well-being of Canadians, which is something that's important to me, but also making successful and large business out of it. And so stay tuned. But once we're sort of ready to launch that in the coming months, I'll be excited to share that with anybody who's interested.
Oh, that's awesome. So, what are some fun things that you actually like to do, Guy? Like, I know you get some, like, do you golf? Do you race cars, or what do you do?
I don't race cars as much as I'd like to. But one of the things that I've had the pleasure of doing in a lot of ways over the last several months is spending more time with my kids. I have two young kids at home, and so the opportunity to do the pickup or drop off from school is something that is new to me, but also something I'm thoroughly enjoying. I've fallen in love with the game of tennis, and I probably paid that more hours than I should. And so, if you ask me if I'm a golfer, I'd say I like the idea of being a golfer. I probably don't have the skills to be a golfer quite yet, but certainly enjoying the sport of tennis and doing that a lot, and traveling with family. I did some pretty extensive traveling over the summer, and always looking for opportunities to explore new worlds. But beyond that, what everyone else is doing,
That's
trying to live the dream. That's all we're trying to
that's
do.
that's awesome. I mean, you've done a lot, like in your young life for sure. So yeah, I would definitely take opportunity of everything. And Guy, before I leave, I just want to say thank you very, very much for doing this. I actually really enjoyed this interview because I love hearing like how success grows, right? And your thoughts on it and how you actually got involved in it and stuff. And I also noticed, it's a real privilege for me because you don't hardly do any podcasts, I see, right?
No,
Okay.
that's relatively new. I think I did one a few years ago for a student at
Yeah.
U of T,
So I'm
but
honored
it's a new one
I'm
for me.
honored that you've actually chosen to speak Easy Dental podcast. And again,
My
it's an
pleasure.
absolute privilege to have you on the podcast.
Well, I appreciate the chance to talk, and looking forward to continuing to see Speak Easy Dental talk about some
Yeah.
interesting things
And
in this industry.
and when you launch your new product, we'll have to get on there again too.
I
Okay.
appreciate that.
Thank you.
Take care.